Hello, everyone. I'm James Milan, and welcome to this week's COVID-19 update with our town manager, Adam Chapdelaine. And we will be speaking about a couple of other topics beyond COVID, so I like to refer to this as a town manager update as well. Adam, great to see you as always.
Good to be here. Good to see you too.
Yes. Sporting your Arlington shirt.
Arlington Pride. I've expanded the fleet of Arlington polos. So
good for you. Got several things I want to ask you about today, including the Metro North COVID-19 vaccination collaborative, and we'll talk about that. But let's get as always, an update on the status of COVID-19 here in town.
Absolutely. So I think I would very briefly say that things from a statistical point of view are very positive in Arlington, although I shouldn't use that framing in that our positivity rate is down, but it's good news. And I think we're seeing that across much of Massachusetts now, with Massachusetts and New England having high vaccination rates, transmission rates or positivity rates seem to be coming down, which is a good thing. And the governor, as we know, has announced sort of working towards August 1st being some return to a post-pandemic world. That said, we're still talking nearly every day as a group, and I think we're worried about about the more recent news of experts saying we're likely to not reach herd immunity because of vaccine hesitancy, and watching everything that's happening in India and what that might mean, the tragedy of it in and of itself for India, and what that might mean for the rest of the world in terms of really getting a handle on the virus, continues to give us concern about where the trajectory of this virus is going. But that being said, right now things are positive, and a lot of that is a tribute to the good work of our Health and Human Services staff, and a tribute to Arlington residents for pursuing vaccination in a higher percentage than really much of the rest of the country.
Yeah, as you say, as you've often said in the past about this and other things, we are not, there are no borders around Arlington. And so we are inevitably, both responsible for our own behavior collectively, but also, vulnerable to that of others. So we'll have to see how this unfolds. So to talk a little bit more about the collaborative that I was just mentioning, I remember you speaking a couple months ago, it feels like, about proposing this consortium to the state, and I believe that it was even approved, but maybe you were they were waiting on vaccines or something to actually be able to roll this out. Anyway, one of the three sites, the site at Tufts University, is running as of this week, I believe. And so if you could just tell us your thoughts, and also just how this is meant to work, and more precisely what this Metro North COVID-19 vaccination collaborative is.
So this was part of a collaboration that started several months ago between a number of Metro North communities, trying to be able to get a more local vaccination clinic. Frankly, we applied when we were begging for a vaccine and residents were begging for a vaccine. We've quickly shifted into a world where we're begging people to get vaccinated. It's sort of remarkable how quickly that paradigm has shifted. But this was approved several months ago, maybe a month and a half ago. This is the first week that this collaborative and some other regional collaboratives in the state have received vaccine. There still are, as far as I understand it, a significant number of appointments available. And the goal of this is to try to get vaccine closer to where people are, and if at all possible, try to reach either vulnerable or historically underrepresented communities to be able to get the vaccine to them. So for now, it's starting at the Gancher Center at Tufts. So people living in Arlington actually have some pretty good proximity to that as compared to some of the mass vaccination sites that had been established by the state. And we're hopeful in the upcoming weeks, we might be able to, as Arlington, access vaccines through this collaborative and be able to get out to different parts of our community that haven't yet been able to access vaccine. In addition to the Metro North Collaborative, Health and Human Services has also launched a campaign to try to get to those 75 plus that have not been vaccinated yet. You probably recall you had asked me, based on a resident's question to you a couple of weeks ago, about why our percentage was lower than a few of our neighboring communities in terms of vaccinating people. I think it was over 70 or maybe over 75. And as we've looked into it, we have this group of about 700 people of that age that haven't been vaccinated. But we've now launched an effort through the Council on Aging, through Health and Human Services, reaching out through their partners in the community, the Housing Corporation of Arlington, the Arlington Human Services Network, and other groups, to really try to reach out to these people and see what we can do to convince them to get vaccinated. It will protect them, it will help the community. So we're trying to work with people to get through what their vaccine hesitancy might be. So I think, like I said, it's interesting how quickly the paradigm has shifted from begging for vaccine to begging to get vaccinated. But HHS is really focused on that through both the Metro North Collaborative and the local effort to do the outreach to those 75 plus.
Yeah, and as you mentioned, those 75 plus, that 75 plus population, I think it's important to note that both the resident who brought this up, I believe, and our focus at that point, your focus in responding to that question, as well as the question itself in being asked, I think, was around how to get these folks vaccinated, assuming that they would want to be. That was at least my assumption. And we were wondering about what the logistics were, or what the logistical holdup was, et cetera. And we didn't even kind of mention the fact that it could well be just that they are reluctant to do so for whatever reason. So that's a whole other battle to be fought. In addition to now that we have vaccine in hand, et cetera. So we will continue to monitor that situation and the success of your guys' efforts around that, because of course that's of great concern to all of us in the community. I had a chance to speak to our DEI director, DEI being of course diversity, equity, and inclusion, Jillian Harvey, earlier today, and one of the things we touched on was the fact that the National League of Cities racial equity training that that town staff has been undergoing had a second round of sessions for 2021. This again was picked up from when it started back in January 2020, and then a long pause for obvious reasons. But anyway, since those sessions picked back up, just wanted to get your thoughts on this latest round of the training and what next steps are.
So we did that training last Monday and Tuesday, a week of, not this week, but the week prior, all virtual. And we really shifted from what the National League of Cities team calls normalizing into operationalizing. So there was some refreshing on normalizing the reality of the racial history of our country. But then we really quickly moved into smaller groups to begin to analyze various departmental policies, programs, and operations to identify instances of where there could be a discriminatory or racist aspect of the way that we do business in town. And I think for a good portion of the participants, it quickly made things real to them. As I've been, there are some people that come in on board, and there's some people that need to be brought along to be on board. And I think there's some segment of people, not even just town staff, but I think people in general that might even acknowledge, I think racism is real, but how does that apply to me? And I think what we were able to achieve last week was at least an initiation of people starting to understand how it might apply to how they do their jobs on a daily basis. So not claiming that we've necessarily solved anything, but I think we took a really strong next step in digging into departments, whether it be from recruitment and retention of a diverse workforce, looking at service delivery, looking at the way we receive complaints and how we enforce various bylaws across town. We really took a wide look at departmental operations, and what groups started looking at last week, they'll now continue to work on in the upcoming weeks to provide further follow-up to the National League of Cities. And follow up to that, we'll be doing our 301 training. We haven't selected dates yet, but hopefully sometime in the next month or two, and continue to move this effort forward. And it was great timing because April was also Stand Against Racism Month, and Jill Harvey, our DEI director, put together across all departments a really great effort over the last month, either herself helping to facilitate dialogues within departments about issues of racism, or giving department heads the tools they need to work with their staff to have a discussion about race. And a lot of departments really dug in and participated. The planning department was exceptional in that regard. The library, the police department dug in, even public works, really across all types of departments. It was a really good month between the National League of Cities training, the commitment to stand against racism. I think our efforts on issues of DEI were really highlighted in April.
Yeah, one of the things that stands out, both in talking to you and to Jill about this, is that it is so clearly a step-by-step process, and we are still relatively early in those processes, but it is encouraging work that's been done so far, is what it sounds like, and there is something to build on going forward here, and so that's, again, encouraging news. Thanks for sharing that. And I did want to just remind our audience that we've referred to the DEI update. We do these with you each week, and we're happy, very, very happy to be able to do so, and it makes sense to do so on a weekly basis. The DEI update we are now going to be incorporating into our own TV schedule, and people will be able to find it, of course, on the town's website as well. We will now be doing that for sure on a monthly basis, and we're glad to be able to announce that to folks. So either on our TV channels or on our website or on the town's website, you'll be able to find that going forward. Adam, let me ask you, I know we've taken quite a bit of your time already today, but I just wanted to ask about town meeting. We speak on Thursdays to you, and so that means we've just finished 2 more sessions, the 3rd and 4th of this year's. Again, to remind people, we started with a whopping 91 warrant articles for town meeting to get through. A lot of those were consolidated in a consent agenda in the first week, and you guys have really been kind of digging in further into the weeds in the sessions this week. So please, if you can give us a couple of highlights of what you covered and how it went.
So there was a slower night on Monday night and more traction gained last night, but further important work was done. Last night, there was final action taken on ranked choice voting by town meeting, which will put on a future ballot for town residents to vote on as whether or not they want to change the way elections are conducted in Arlington to a ranked choice style of voting. Also last night, town meeting voted to send to the legislature a home rule petition to create a real estate transfer fee, which would go directly into the Affordable Housing Trust Fund that was established by town meeting back in the fall to help produce more affordable housing in town. So pretty significant action, or at least significant movement forward on potential action for 2 important issues in town. Then last night, we got into the zoning articles. A number of more administrative or minor zoning articles were passed last night, and then got into Article 35, which is in regards to industrial uses and trying to create more flexibility in the industrial zones to prompt development in the industrial zones in Arlington. I think, unfortunately, there were several speakers last night who made very egregious, unfounded claims of malintent by both appointed board members and town staff that unfortunately really degrade the conversation at town meeting. And we're thinking about how to best respond to such egregious claims. But that being said, the night ended during that article. We'll pick up budgets next Monday, likely go through Wednesday with budgets as well as hearing from the Minuteman schools, and then likely pick zoning back up on May 17th.
All right, so it looks like, this is going to be one of those 6 to 8 sessions of town meeting, which, again, we might have anticipated given the volume of business that needs to be attended to. All right, well, thanks as always for your time. Anything that we've missed?
I plug that this is Eco Week. There's a ton of activities and programming being offered for Eco Week in town. You can access that on the town website, and there's some good stuff there. Hard work being done by town staff, so just a plug for that as well.
Yes, hard work being done by town staff, including my wife. So maybe I should have remembered to ask you about Eco Week. All right. Well, hopefully she'll forgive me, as will our audience. And Eco Week is currently operating lots of activities, as Adam was saying. All right, this has been Town Manager and COVID-19 update with our Town Manager, Adam Chapdelaine. I'm James Milan. We appreciate Adam's time as always, and we appreciate yours as well. Thanks for joining us. We'll see you next time.